Hi, I'm Nat from PACOP, and today on Clinical Bites, we are looking at the SAS for care workers and the symptom of fatigue. The symptom assessment scale is one of the assessment tools we use in PACOP. We have a number of resources to help you get the right SAS scores from residents, and you'll see on the screen we have a picture of the SAS ruler with the faces on it. We have a picture of the sheet where you record the SAS scores, and we also have an information flyer at the back which says your symptoms are important to us. That information sheet is for us to give to the residents so that they can read about why we ask them every day for their distress scores about these symptoms. As always, we know the most important thing to remember when we're collecting the SAS scores from residents is we are rating the distress in relation to that symptom. So for this clinical bite, we are trying to work out the level of distress that the resident feels in relation to their fatigue. The best way to find out this information is to chat to the resident, talk to the resident. And for this symptom, perhaps we could chat to the resident about their fatigue level when we ask them about what they're going to be doing for the day. Are they going to be joining the activities? Are they going to be seeing anyone? What are they going to be doing? And if they are saying, I'm too tired or I can't be bothered, it's too much energy, that is a perfect opportunity to then speak to them about their fatigue level. Fatigue, surprisingly, is one of the symptoms that causes the most distress to people, including residents. When they lack energy to do the things that they really want to do or to do the things that they actually have been looking forward to doing, it's actually quite distressing when they then can't do that because they just don't have the energy. A great way to ask them about how much it distresses them is to say, how much does this bother you? Or I can see this actually bothers you quite a lot. Is that correct? Is that true? And of course, once we get this information, we need to then report it. Of course, if the resident isn't able to tell them themselves this information, you can record this distress level for them by means of proxy. Scoring by proxy means that another person rates the symptom or distress level on behalf of the resident. If the resident themselves are unable to give you this information, you can rate this on their behalf by proxy. A proxy score is when someone rates or a symptom or distress. If the resident is unable to tell you themselves their level of distress in relation to fatigue, you can rate it for them by proxy scoring. Proxy scoring means that a person rates the distress level on behalf of the resident. If the resident can't tell you, then you are able to score this by proxy by putting down the score that you think most accurately describes how the resident would be feeling. If there are family or friends available, you can speak to them about what they think the distress level would be for this symptom. Or of course, you can speak to another one of your co-workers and discuss how much you think the resident appears to be distressed from their level of fatigue. We also have the descriptors in the score guide, which you'll see on the screen in front of you. And that gives you a little bit of a description of what the resident may look like for these levels of distress in relation to fatigue. And then remember, once we have this information, we need to record it. We need to write it down. We then need to have a look at the ruler, and the ruler's on the screen now. And if we have any absence scores, we don't need to do anything, of course. If we have mild, we need to report it to the nurse within the shift. Any moderate scores, we need to report to the nurse within 30 minutes. And any severe scores, of course, we need to report them to the nurse straight away. Thanks for watching this PACOP Clinical Bite. Please watch all the other ones to do with the SAS and get the. Thanks for watching. Please make sure you watch all the other clinical bites in relation to the other symptoms for the SAS for care workers.